Could you imagine every time you took a breath, you had to struggle to breathe? With people with the disease called cystic fibrosis, also known as CF, that's a reality. CF is a disease that's passed through genetics from both parents, and what it is it causes thick mucus to build up in your lungs and your airways and your pancreas. It's present at birth, and it makes it really hard for you to breathe and to digest food. It's mostly seen in Caucasians, and most of the time it's diagnosed by age 2, but in some cases it's been all the way up until 18 before it was diagnosed. Some of the symptoms of cystic fibrosis in newborns can be delayed growth, failure to gain weight at a normal rate, ceased bowel movement for the first day or 2 of life. The skin will have a salty taste to it, and coughing, which is a very high symptom on the list. A little bit later in life, the men with CF they won't be able to have kids. They'll have pancreatitis, and they'll have respiratory problems. Even a little bit later, some of the symptoms is chronic respiratory failure, bowel problems, coughing up blood, diabetes, failure of respiratory system, liver disease, malnutrition, and pneumonia. Some of the tests to show that CF is that you have CF for newborns. A lot of times they'll do an IRT test to screen. You can take a blood test and it'll show you if the gene is there. So you can take further tests to see if you actually have cystic fibrosis. Chest x-rays, lung function test, and fecal fat test all help to see if you have cystic fibrosis. With people with cystic fibrosis, they have a very short life expectancy. 10 years ago, it was the life expectancy was only 18 years old. Now it has grown to 35 years, and research is constantly improving that. And research also shows that 90% of newborns can live up past the 1-year mark. As of right now, there is no known cure for cystic fibrosis, but there's a lot of treatments that will help the life expectancy and just to make their life a little bit easier. Antibiotics will help lung and sinus infections. That's very common for cystic fibrosis patients. Inhalers will help to open up the airways to help you breathe a little bit easier. In some cases, lung transplants may be an option. Oxygen therapy may also be an option. My brother had cystic fibrosis, and a lot of times he'd have to do breathing treatments and vest treatments. And what a vest treatment is it's just a vest that you put on, and you hook it up to a machine, and it just shakes you. It shakes your lungs, and it shakes up the mucus to where you can cough it up and make it a little bit easier to breathe for you. He was also placed on oxygen a little bit later on to help him breathe. For cystic fibrosis patients, the things that they need to avoid are smoke, dirt, fumes, household chemicals, mold, and dust. And they also need to be precautions taken in the house of someone with cystic fibrosis. Things that help is drinking plenty of liquids and working out daily and exercising. Now that you know, now you know about CF and ways to help if you ever know somebody with CF.